Welcome to the second video in this three-part series on memory and thinking problems. These videos were made by doctors and researchers from a project called Advancing Diagnosis of Dementia in Primary Care Practice. The project is supported by the National Institutes of Health. My name is Howard Rosen. I am a neurologist at the University of California, San Francisco Medical Center, and also the researcher who is leading this project. This video explains how doctors figure out what might be causing memory concerns. It makes more sense if you've seen part 1, so we suggest watching that first. These videos were made for people in a research study, but the ideas also apply to many older adults with memory or thinking problems. We hope that they help you understand how doctors look for answers. This video is for anyone worried about memory or thinking changes in themselves or someone close to them. It assumes that you're open to talking with a doctor to learn more. We'll explain some health issues that can affect memory. This can help you understand what your doctor may ask about. These visits can sometimes feel long. The doctor may ask many questions to get the full picture. Watching this video first may help you feel more ready and help you share things that matter. This slide is to remind you that there are many reasons you might be seeing your doctor. You may have had trouble with memory, thinking, or changes in mood. Maybe you noticed it yourself, or maybe your doctor brought it up after a few questions. We talked more about this in the first video. Your doctor will focus on two big questions. First, how serious is the problem? Sometimes memory changes are small and they don't affect your everyday life. They may just be part of getting older, not a sign of illness. Other times the changes are bigger. They might even make it hard to do things like paying bills, cooking, shopping, cleaning, or keeping track of appointments. If the changes have gotten worse over time and are now making these things harder, the doctor might call it dementia. Sometimes it's in between. It's more than what's expected with age, but not serious enough to be called dementia. In the first video, we talked about how some brain problems can start small and slowly get worse. Also, dementia is not one disease. It's a word doctors use when memory or thinking problems are making it everyday tasks harder. After the doctor understands how much the changes are affecting your life, they'll ask the second big question: what's causing the problem? This is a reminder. Memory and thinking changes or problems can have many causes. Some are medical problems in the body, like infections, low vitamins, or poor sleep. Others are problems in the brain. One group of problems your doctor will think about is called neurodegenerative diseases. These are brain problems that get worse over time. They slowly damage brain cells. Examples include Alzheimer's disease and Parkinson's disease. These brain problems are common in older adults. That's why doctors always think about them when someone has a problem with memory or thinking. To understand what might be causing memory or thinking problems, the doctor will start by asking you about your story. They'll want to know, when did the problem start? What was the first thing you noticed? What came next? For example, did memory problems show up first, or did something else happen before that, like changes in feelings or behavior? They'll also ask if the problems have been staying the same or slowly getting worse. Your answers give the doctor important clues. They help the doctor think about what might be going on. To see how serious the problem is, the doctor will ask if it's making everyday life harder. They may ask about things like paying bills, keeping up with tasks at home, or work responsibilities. They will also ask for examples. It helps to hear real-life stories about what happened that made you or your family start to worry. People use the word memory in different ways, so the doctor will ask what kind of memory trouble is happening. This helps the doctor understand how big the problem is and where it might be coming from. The doctor will ask about other health problems that might affect the brain. They'll want to know your past medical issues, what medicines you take, and whether you use alcohol or drugs. Even your hobbies and past jobs can give clues about brain health. If this is your first visit, try to bring this information with you. If the doctor knows you well already, they may have most of it. The doctor will also ask how many years of school you completed. This matters because you may be asked to do short memory or thinking tasks. The results can look different depending on your education level, so the doctor needs that information to interpret them well. They'll ask about your family's health, especially if any family members had memory problems, dementia, or depression. Most memory problems don't run in families, but some do. Knowing about your parents, brothers, or sisters can be helpful. After asking questions and hearing your story, the doctor will do a physical checkup. They may ask you to do some tasks to see how your memory and thinking are working. In most primary care offices, these checks take about 10 to 15 minutes. If the doctor thinks more information is needed, they might send you to a specialist called a neuropsychologist. That person can take longer and more detailed checks of your thinking. The doctor will also order blood tests to look for health problems that can affect your brain, like low vitamin levels. They will likely send you to get a picture of your brain. This helps them to see if there are any big changes like strokes or brain shrinkage. There are different kinds of brain pictures. A CT scan or CAT scan uses X-rays. An MRI uses a big magnet. You lie still while the machine takes pictures. In some cases, they may suggest a PET scan. This kind of scan can show how the brain is working. These pictures don't hurt. They may take some time, and the machines can be loud. The doctor or technician will explain everything before it starts. Brain pictures can help doctors look inside your brain. CAT scans and MRIs are two common types. They can show big problems like strokes or tumors. A stroke happens when blood can't reach a part of the brain. A tumor is a lump that shouldn't be there. We're not showing those kinds of pictures here. If something that's like that, a tumor or a stroke, shows up in your MRI or CAT scan, your doctor will explain it. MRIs can also show small white spots. These spots may build up slowly over time. They're common as people get older. You can see an example in the MRI picture on the left. We added yellow shading to help you spot these changes. These spots may or may not be linked to memory changes. If they show up, your doctor will talk with you about what they might mean. Brain pictures can also show if the brain has gotten smaller. That's called shrinkage or atrophy. It can happen with age or with brain disease. The middle picture of an MRI scan shows a brain from an older person without serious problems. The one on the right shows a brain from someone with Alzheimer's disease. We shaded one side of each brain in yellow. You can see that the space between the bumps is wider in the scan at the right. That means the brain has shrunk more in that person. When the brain shrinks, fluid fills the empty space. Some people have more shrinkage than others. It doesn't always mean there's a disease. Now, one important point. These brain pictures can't show tiny proteins. Some brain diseases, like Alzheimer's, are caused by these kinds of tiny proteins building up. They hurt the parts of the brain that help with memory and thinking. We talked about this in the first video. We now have other ways to look for them. Some of these proteins can be found in the blood. We'll talk more about that in the next video. This may feel like a lot of information, and you're right, it is. Doctors need time to get the full picture. A brain doctor called a neurologist might take an hour or more. Some clinics break the checkup into shorter visits. They may collect some details ahead of time. That could be by phone or on paper or online. This project is trying out that approach to see if it can save time and still give doctors what they need. The goal is to make visits shorter but still complete. Your doctor might need more than one visit. They may gather information first, then, once your blood test and brain pictures are ready, they'll meet with you again to go over everything. They'll explain what it all means. After your regular doctor gathers all this information, what happens next? Sometimes they find a clear cause of the problem. If that happens, they may recommend a treatment. Other times, your doctor might want help from another expert. For example, sleep problems, like sleep apnea, are common. They can affect memory or thinking. If your doctor thinks sleep might be a part of the issue, they may suggest seeing a sleep specialist. Or if they notice changes in mood, they might recommend talking with a mental health expert. They may also refer you to a brain doctor called a neurologist if you have a problem that kind of doctor might know more about, such as a problem with your movement. Your regular doctor may also order blood tests or brain pictures. These are the same pictures we discussed earlier, like CAT scans or MRIs. Sometimes they'll ask a specialist to help with that. You will be asked to come back later to review everything together. This gives time to see if the treatments or referrals helped. If the problem is still not clear, your doctor may begin to wonder about a brain disease. These are called neurodegenerative diseases, like Alzheimer's, covered in the first video. If that seems possible, your doctor will talk with you about next steps. You'll decide together what to do, including whether to have more checks or see another specialist. We hope this video helped you feel ready. Maybe you watched it before your doctor visit, or maybe afterward to understand things more clearly. Either way, we hope it was helpful. Doctors use many ways to understand memory concerns. In the next video, we'll talk about some new tests. These tests help find signs of brain disease. That includes diseases like Alzheimer's. We look forward to sharing that with you.